Hi there. How are you? I definitely think we've seen each other before. I think you've been here for quite a few cranial nerve exams, is that correct? Yes. Well, what brings you back for another? Yeah. Okay, so no accident this time. You just want a check to calm your nerves about it, to reassure you. Okay. You must find them relaxing, do you? Okay, I can understand. I think I would find them relaxing myself. But that's fine. We can do a reassuring, relaxing cranial nerve examination today, just to make you feel comfortable, less anxious, and help you relax a little bit more. Do you want to confirm your full name and date of birth for me? Okay, can I just check that we have the correct address on file? Yeah, yeah. Yeah, that's what we have on file. What's the post and zip code? Okay, and let me just double check the number we have on file for you. Yeah, we have that too. Since your last visit, has there been any change in your medical history? Have you been diagnosed with anything? And has there been any change in your medications? Okay. Alright. Not a problem. Okay. And have you had any other injuries or anything that we need to be aware of since the last visit? Okay. Alright. I think we are good here to get cracking with today's cranial nerve exam. So, we're going to begin, as you'll be aware, with the smell test. So we like to start with your olfactory nerves. Now, to do that today, we're going to use our aromatherapy oils. Okay. Now, there's many oils in here, and they have a variety of different types of scents. Now, you may not be able to guess exactly what the scent is, but as long as you can describe it to me. So, there may be something that smells florally, or sweet, spicy, herby, citrusy, these sorts of scents. If you can't identify the scent, just describe it. Just describe what you're smelling. Okay. So, I'm going to make sure that I sniff each one as well to make sure that these are definitely giving the right scents. And there'll be a variety, okay? So, the first one. Yep. Okay. So I'm just gonna take a deep breath in and out. Okay. Minty. That's correct. It's a type of mint. It is indeed peppermint. Okay. Next one. Okay. Mint. It is indeed peppermint. Okay. Next one. Peppermint. 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 It is indeed peppermint. Okay. lemon. It is. It's lemongrass. But I'll give you lemon because it smells more lemony than lemon it does itself. Okay, a little bit harder one now. Just breathe in and out. A little bit herby. Florally, you're not sure. But you got the herby kind of florally herbs. That's fine. It is clary sage. So that's absolutely fine. Okay. Alright. Our next one. Breathe in and out. It is a kind of fresh but musky scent. Any ideas? This is the baby Jesus oil, frankincense. Okay, let's try a different one. Yeah, that's a good one. Okay. Breathe in and out. It's very sweet. It is vanilla. It's unmistakably vanilla. It's lovely. Okay. Our next one. Breathe in and out. Musky. Any clues? It is indeed sandalwood. It's quite popular and common in sort of male fragrances. Okay, our next one. Breathe in and out. Cinnamon. It is indeed very recognizable. Let's do 2 more. Okay. Since you're so good at this. Okay. Breathe in and out. It is, it is tea tree. Absolutely well done. That's a good one to have got. And our final one. You should hopefully get this one as well. Breathe in and out. It's florally for sure. I think it's undeniably rose. You could pop that in your bath. Well, you'll be pleased then that your smell was top notch. No problems there with your sense of smell at all. Okay. So, okay, we're gonna move on to your eye test. So how have your eyes been since we saw you last? Has there been any changes? Have you had to have glasses? Okay, that's good. Well, let's do the Snellen chart first. I've got the little baby one today. Well, my baby in my belly is wriggling away. I think it likes the sound of this ASMR. Okay, so I want you to read the letters from the top all the way to the bottom, okay? E, then L, T, F, P, DHJBS, EPTZO, CFDHJ, LTFPH. Wonderful. You have 20/20 vision. That is a great achievement. Okay, let's have a quick look at those eyes. So if you could take a look up, so just snip up for me. Okay, and look down. Okay, you look over to your right and to your left. Okay, and look back up for me. And then to your right and to your left. Very good. Very good, very good. Okay, so if you can focus on this pen. Okay. And just watch it as it comes all the way in and back out again. In and out. And in and out. Good. Now I'm going to cover each of your eyes in turn, and you need to look at my shoulder, okay? And then I want you to tell me when you can see my fingers in your peripheral vision. Okay, so I'm going to cover this eye first. Okay. Good. The other eye, look at my shoulder. Okay. Perfect. That was really good, really good. Okay. Yeah, I don't see any issues. Has there been any change to your color vision? I don't have my color chart here with me today. Have you noticed any changes to colors, or everything's just as vibrant as normal? That is good to know. Wonderful. Alright, well, I think that is us done with the eye test. Okay. Now for hearing, I'm going to take a quick look into your ears to begin with, okay? Yeah, just in case there's anything that we need to have a good look at or remove. I'm sure it'll be fine though, because we want to have your ears unblocked so that we can, fully get the experience or get the results from your nerves that control your ears. So, alright. I'm gonna start with this ear, okay? Just gonna remove that like so. I'm gonna come here and I'm just gonna have a good look in here. ears have quite a bit of wax build-up. So I'm just going to give them a really quick clean out. It's not deep. I'm just going to use, I've got a little bit of cotton wool, and I'm just going to give them a nice little clean out. Okay, so we'll do this one first. Wonderful. We're going to do the same with this side. Done. Alright, now we can do your proper hearing test. So we'll start with the tuning fork. So we're going to play this 3 times all around your head, and you just need to tell me when you can no longer hear it. Okay? Great. And then we're going to do the distraction test. So I'm going to whisper some numbers to you, and you just need to repeat them to me. Okay? 7, 25, 12, 86. Great. And now the other side. 3, 91, 17, 34. Good. Great. Okay, so we've done hearing. We're gonna now do the touch test. So this is the one you'll remember that's all to do with your what do you call it? Your your sensory nerves in and around your face. So we do something really soft, and then we do something a little bit prickly. And you just let me know that you can feel them, and if you can't feel it, you let me know. Okay. So we'll do the soft. Here, just touch your ears slightly as well. And this side. Okay. And now for the prickly. It is not sore, like I did myself, but it's just a little bit sharp, okay? So same again. Okay, and then your ears. On the other side. Okay. There we go. That was good. You could feel all of the soft and all of the hard. So for our final checks are movement, okay? So we've got a variety of movements. We're going to check your reflexes first. So I'm going to gently tap this against each one of your knees, okay? Ready? Good. And your other knee. Good. We're going to look at your corneal reflex. So I'm going to put the corner of this just against the outer edge of your cornea. And see if it touches this side. Good. Good. Okay. Now I'm going to put my hand here. And I want you to try and turn your head against the pressure on my hand. So turn your head to the right. Sit. That's it. And again. And again. Okay. Same on the other side. Try and turn your head to the left. 1, 2, 3. Good. Okay, I'm going to put my hands on your shoulders. Try and shrug your shoulders, okay? Shrug. 2 and 3. Excellent. Okay, try and blow your cheeks out when I put my hands on your cheeks, okay? Try and blow them out. That's it. Great. Try and open your eyes against me trying to close them. This one. Good. This one. Good. Okay. Try and smile with me, trying to stop you from smiling. Okay. Good. Okay, can you open your eyes wide? Stick your tongue out. Just gonna have a quick look. Make sure there's no fasting and no wasting, in there. See, okay, wiggle your tongue around. Like this. Okay, well, you'll be pleased to know that you're absolutely healthy, 100% healthy. So don't stress, don't worry. You're perfectly fine, okay? But of course, if you have any other concerns, you know where we are. Alright. Well, enjoy the rest of your day.